those days with COVID here, because you all know that I'm director of Serbian Dental Chamber, so I had a lot of job to do. However, I'm now with you, and I would like to share my experiences with conventional grafting and, of course, to emphasize cortico-basal implantology for treatment of the trophic maxilla. Okay, and today I'm going to talk a few words about the trophic maxilla, and then just to show briefly conventional options of implant rehabilitation. So I will talk a little bit about sinus lift and reconstruction of severely resorbed maxilla with iliac crest grafts, and then I will switch on non-grafting procedures and to show you a few strategies that I use with cortico-basal implantology. All you know, the treatment with conventional dental implants imposes no problem today if enough bone is present. And generally, we are trying to achieve 10 to 12 millimeters of vertical bone when we are talking about conventional implantology, and at least 5 millimeters of horizontal bone width. And it's well known that trophic maxilla is it's the most difficult area for rehabilitation. Why? Because during the time after extraction of teeth, decreasing on bone volume started with expanding antrum and resorbing the crest. And generally in situations like this, we mostly have D3 or D4 density. And this is the bone atrophy classification given by Edford in 1963 and Cabell and Howell in 1988. And we have these 6 phases of bone atrophy. And now when we have, for example, level 4, level 5, or level 6, we couldn't use conventional implants. So we need to do something. Today I'm talking about maxilla. We need to perform augmentation procedure, or as you will see later on, because all of you are cortico-basal implantologists, I will show you a few cases which I done in the past years. Severe resorption is especially below the maxillary sinus, as you see here. And when applying conventional screw implant concept, often the most disabled patients are denied for treatment. And with conventional concept, we often cannot treat those patients who need the treatment most. And I always put those slides in my lectures. What should we always keep on our mind? First, our patients don't want bone augmentation procedures. And our patients don't want implants. Our patients only want fixed teeth. That's our goal. We are trying to achieve fixed teeth to our patients. That's the most important thing that we can do for our disabled patients. Now I will proceed with conventional options of implant rehabilitations. So what are the possibilities of a trophic maxilla reconstruction? There are several of them, as you can see here: autogenous bone grafting, allogenic bone grafting, xenogenic bone grafting, alloplastic materials. Sometimes we use destruction osteogenesis, bioengineering, and in the recent time, as you can see here, 3D bioprinting. But we're mostly nowadays use autogenous, allogenic, and xenogenic bone grafting, and in the recent times 3D bioprinting. And this is an example of 3D bioprinting CAD/CAM technology, as you can see here. But you see, this is very complicated procedure that we can use performing this technique for implant rehabilitation. So I will move to basic of bone augmentation for posterior maxilla. This is sinus lift. Why? Because we have limited bone height, poor bone quality, which is very important, and of course maxilla